Rob, Terry, from the time I worked at WHO, really has a reputation of gold on both the personal as well as the technical level. He's led a lot of important efforts, including he was one of the lead authors of the 2013 WHO World Health Report, Research for Universal Health Coverage, which has had an important impact. He's worked in many countries, including for Oxfam and DFID. He has actually recently led the WHO Special Program for Research and Training in Tropical Diseases, TDR, and we have the privilege of actually working with him as part of this capacity. So, Rob, a very warm welcome to Beirut, and we look forward to hearing.
Thank you very much, and thank you very much for this invitation. Having previously lived in Ramallah and worked in Gaza, I have to apologize. I've never been to Beirut before, so it's fantastic to be here for the first time. And you have a beautiful campus. I mean, it's a really nice place to work. The environment seems very good. So what I was asked to do was just to give a very brief, and I will try to be brief, overview of sort of research priority setting at a sort of fairly high level and at a sort of strategic level. And a lot of this is based on the work that I've done at WHO and with other organizations. And in a sense, this really just sets a little bit of a frame for thinking about how to organize and perhaps communicate priorities. What it perhaps doesn't do, and as has already been highlighted, it asks the questions, and it'll be for you and others to provide the answers. So I don't lead TDR, I work for TDR, so my director would be very upset if I didn't at least have a few slides on TDR, so there will be a few. So it's a special program of WHO. It was established in 1975, so we've been going more than 40 years, but our focus is on what we now talk about as the diseases of poverty, and I think that's, again, a very interesting concept to bear in mind, but we're talking about the infectious diseases of poverty. As I say, we've been working for more than 40 years in this area. We started very much looking at products and product development and very much focused on interventions, and I'll come back to that a little bit. Where we are today is very much on supporting research for implementation. So in a sense, I think that's actually quite important, and I would suggest for the NCDs that's even more important. It's about how to engage with populations and communities, and a lot of the work that can be done well in NCDs is about prevention, and that's about engaging in communities. Currently we're working in more than sort of 50 countries or so. We're supporting 100 projects, and as I said, we have a focus on the infectious diseases, those that are borne by vectors, and also looking at implementation. And underlying all that, because the focus is majority on low and middle income countries, it's around building that research capacity, which is so necessary if you're going to do anything in the local context. And we have regional training centers. So in this particular region, we have a research training center based in Tunis. But perhaps more significantly for this audience, we have the beginnings of what I think is going to be a very successful postgraduate training scheme based here in AUB, supporting as I said, implementation research, or research that supports implementation. So that's the headlines done on TDR. Now I'm going to talk a little bit about research priority setting and how that's been thought of at WHO. The main thing to bear in mind, WHO has to deal with a huge scope of different public health issues from the NCDs through the infectious diseases, through road traffic and safety, through a whole range of different things. So when I was asked to come up with a research strategy for the whole organization, it was quite a challenge. But inevitably, what we ended up with was something that can really be applied to any situation. And I would still stand by this. This was published back in 2010. I've yet to find a public health issue where this doesn't work. And in a sense, organizing any research strategy really involves being focused around four main pillars. And those are, what is your capacity? How are you going to strengthen the health research system and the health research system, the health system, in order to deliver your strategy. So very much thinking about capacity. Priorities, well, that's in a sense one of the main focuses of today, but also being sure that whatever is being done is actually in line with what the public health needs are. And we had a teleconference last week, and I think one of the sort of key concerns here, and I'm sure we'll hear about that later today, is perhaps a mismatch between the research that's being undertaken and the priority needs as they're understood. And I think it is always a challenge, but that's a real challenge to ensure that what is being done, and particularly in public health research, has an impact. Standards never sounds very exciting, but in actual fact is really quite important. And it's about ensuring that there is really good research practice. And it can be as straightforward as ensuring that whatever is published is available to others. And so some of the standards would be around open access publishing, for example. It's about good research practice and ensuring that quality is undertaken throughout the whole of the effort. And the last thing, and again, Richard will talk about this later, is translation. There is very little to be gained in research that ends up in a drawer and is not utilized and used. And in a sense, that comes right back to the prioritization process. Unless the research itself has been identified with a view to being used, I'm talking about public health here, then the value of that is very little. And the one bit that people forget about, and I could almost say WHO the same, is the last bit is the organization itself. Is it set up? Is it managed? Is it organized in a way to deliver those 4 pillars? So that's just at a very high frame. I would suggest any research strategy should try to think about how it's supporting capacity, priorities, what are the standards that's needed, and how the research outputs are going to be translated. The number of principles on the side, again, this is just, they shouldn't be forgotten about always ensuring quality, always ensuring impact. And something which I think may need to be thought about here, which is who is setting the research priorities. If it's only through a discussion with researchers and other researchers, then you'll have a very specific set of priorities, and dare I say it, they may well just reflect the interests of the researchers themselves. One of the things that I did when doing the research for health strategy was look at the various methods and approaches, and there are many, on how research priorities are set. Now, this is quite a busy slide, and I will provide the reference in the set that I leave behind. But essentially, there are sort of 9 areas, a sort of checklist, if you like, of good practice in setting research priorities. And I've yet to find this not work in any subject area, whether it's, as I said, infectious diseases or the NCDs or others. And I won't go through the slide in any great detail, but I would highlight particularly the first one, which is understanding the context. And that really is understanding what is the influencing factors on the public health situation that we're talking about. And also, I would talk about the third one there, which is inclusiveness. And I would strongly suggest that in the NCD area, even more so than many other, because so much of it is reliant on behavior, that including the populations and community-based work is absolutely essential to identifying the right types of research priorities, and those research priorities having an impact subsequently. Is it worth doing? There's been very little actually done on the value of setting research priorities and national research agenda. This is an example that we highlighted in the World Health Report in 2013 from Brazil, where a huge amount of effort was undertaken to create a national health research strategy, but subsequently was shown by the budgeting system that the priorities that were raised were matched by the subsequent budget that was actually delivered. That's Brazil. I think it's a fairly unique case in health systems, but it is something to bear in mind. Once you have a strategy, can you actually then evaluate its impact? So I'm not going to go into great detail about this, but again, if you haven't had an opportunity, there are a number of different strategies and tools and background material that's in this World Health Report. Again, I think one of the things where we often struggle is the value of how we communicate the value of research and how that can actually achieve national objectives. There's a number of examples and case studies here. This is a very much a sort of practical guide to that. So something else, again, another tool, and I would also argue I've yet to find a public health situation where this cannot be applied. When you're setting your priorities, is to understand in very broad terms the sort of 5 key areas which influence any kind of public health situation. And that is, do we understand the problem sufficiently? Either its size, the burden of disease, do we have the right data? The next sector for research is, what are the causes? Do we fully understand what is causing it? In infectious diseases, it's often a particular parasite or a vector, but those are very much mediated by the environment that you're in, the nutritional status of the person, and all of these other things. And I would say within NCDs, the influence of many other factors, behavior, environment, underlying genetic behavior, are all things that can withstand research. Solution is the area that most people jump to, and is the one that most sort of people would think of as when you're talking about research, which is, what are the technical solutions, what are the interventions we need? And that is very much the case. But it can also be, particularly in the NCDs, other types of interventions, not always about the drug. It could well be about a public health education package. And then the last two, the two which I would say are the orphans of sort of research strategy. One is implementation. At the early stages, are we thinking about how this research will actually have an impact? Will it be translated into policy? How will that policy be used? Can we implement that policy? And the last one is really evaluation. Is the intervention and the plan that we thought we were going to put in place, is it having the effect that we wanted it to have? And in actual fact, if you start by thinking about the evaluation before you've even thought about the research priorities, it's a very good place to start, because unless you can sort of measure the impact, it's very, very hard to create research programs which are going to have the impact that you want. And I'm talking about, this is public health research here, research that's applied and has an impact, not just for the creation of new knowledge. Under solution, obviously, you can break it down a lot further. And again, because a lot of the work I've done is within the infectious diseases, this tends to be around those types of solutions. So you'll see, drugs and vaccines and diagnostics. But again, they also apply for many of those. Do we have gaps in those areas? Now, a lot of research strategies tend to focus in these technical solutions, which are obviously needed, but maybe overlook the implementation and those other things as well. This very simple scheme is actually quite useful, again, if you're trying to compare across different diseases and different disease approaches. And I have an example here, again, it's from the infectious diseases, because that's where I work, but you could certainly apply that. Now, all I'm trying to show with this graph is that under these different diseases, the shape of the research programs are very, very different. Now, all that does is allow you to have a sensible conversation. Have we got the right strategy in place for each of the diseases that we're looking at? So just bringing this back to the focus of this particular meeting. As we've heard, there is a global action plan in place that's going to run till 2020. But in fact, when you read that, they really only used, under the research section, the outputs from that report from 2011, which I think in broad terms is still fairly useful, but in the specifics isn't. And then, of course, if you go back to my earlier slides, the context right now, this was before many of the conflicts that are in this region. So a lot of the priorities which are identified here perhaps are not covered. But again, you'll start to see some of the same areas that in the high-level WHO strategy are repeated here. So putting the NCDs into the global agenda, research to understand what are the determinants, translating those into the health systems. And I think something which is quite necessary, particularly within the NCDs, is these access issues about there are many treatments available, many say, for example, cancer treatments, but extremely expensive, difficult to provide the access. So just the last slide is just a very brief summary of those research questions. This is just to sort of get us on. You can see very much you could probably do this yourself, you know, cardiovascular disease, cancer, respiratory disease and diabetes. Interestingly, nothing there about mental health, of course. The risk factors, which perhaps we know. And then I think another good way of thinking about research priorities in this sector is these kind of cross-cutting issues about how is primary healthcare, how is the health system set up to cope with treatment, and then promoting research practice. There are a number of research priority areas that are described in this report. I would say they could definitely withstand some revision. And for this locality, of course, context is everything. And so I would say the high-level framework is probably useful, but once you get into the specifics, it's a different story.
Thank you very much, Robert. Thank you, Dr. Terry.